An additional 41 aged care homes have been upgraded in terms of the quality of service they provide. Those homes are now receiving 4 or 5 stars, meaning they provide good or excellent quality care. I spoke a short time ago to the Shadow Aged Care Minister and Shadow Minister for Health, Anne Ruston. I began by asking whether she welcomes the progress we're seeing in many of our aged care facilities.
Oh, look, absolutely. It's fantastic to see that our nursing homes are able to meet the requirements that we know that we want to have for our older Australians as they're ageing in these facilities. But we also need to remember that we've seen some pretty tough times for our nursing homes over the last 3 years with COVID. So I think there's a huge amount of credit goes to them for them being able to actually increase these star ratings at a time when it's been enormously stressful and enormously difficult for them.
Do you think that this recommendation off the back of the Royal Commission for star ratings has been a bit of a game changer because it boosts transparency in a big way? People know how their facility's shaping up.
Well, obviously all transparency is good, and I think the opportunity for nursing homes to be able to demonstrate to the wider community the good things that they're doing. And we saw in the first round of the star ratings that most nursing homes were doing really well when it came to their client satisfaction with their services, their compliance and the like. The biggest challenge that we've got before us in nursing homes, which showed up in the star ratings and still is showing up in the star ratings, is access to workforce, because there are requirements for workforce, and that's the area that's probably been most challenging and will continue to be most challenging for our nursing and aged care sectors going forward.
Should the government look at something like a bonus payment like they announced yesterday for the military?
Well, I think one of the things that we do need to recognise is that nursing homes are such an extraordinarily important part of the journey Australians take on in their life, and most of us will probably need some sort of support from the aged care sector as we age. And the ability for them to be sustainable and to be rewarded for the extra efforts that they go to and the support that they give older Australians, I think is something that certainly should be considered. But the sustainability and support by government for the expectations that Australians have and that we have committed to Australians for aged care, I think is probably the most important thing, that Australians' expectations about the care that they will receive in aged care facilities is able to be delivered because the nursing homes have got adequate resources to do it.
Then one of the things is to get that workforce situation fixed is pay. There is going to be a 15% increase for the aged care sector as of July the 1st. The government made that a big commitment. They're going to deliver on that at 15% via July 1. Of course, a recommendation again by the Fair Work Commission. But do you think this is a good outcome?
Well, obviously, providing fair pay to people who are working in the aged care sector is really important, and acknowledge that it will go some way in supporting our aged care workforce to remain in the sector. But it's only one part of what is a critical challenge before the Australian aged care sector and the whole care sector for that matter, and that is access to adequate workforce, most particularly registered nurses. And what we've seen is a very big commitment in addition to the 15%, and that is the 24/7 nursing staff on site and the 200 care minutes, which we've now seen the government admit that they can't deliver. It's caused extraordinary stress, uncertainty for the sector over the last 12 months since it's been legislated to be in place. And we've seen in recent times the government's admitted that they can't deliver on it. We've seen a couple of Labor Party backbenchers also call on the government not to proceed with this. And only in the last few weeks we've seen that the aged care minister has spent $400,000 of taxpayers' money trying to find a workaround for something that she's been told by the sector and by me for that matter, for the last 9 months that she wasn't going to be able to achieve this. And yet we have had 9 months of distress in the sector. So workforce still remains the biggest issue facing our care sector and the biggest issue facing our aged care sector.
On the nurses though, apparently they're at 80% of nursing homes have the registered nurse. Isn't it good that they've made some progress? I mean, they might not get to 100% by July 1, their target, but again, isn't that target providing some uplift in terms of the services provided? in this case by the nurses?
Well, look, certainly having an aspirational target and something that we want to achieve into the future is a really good thing. That's what the Royal Commission actually said. They said that they thought that this was a good idea to be brought in over a period of time up until 2024. That was before COVID, before we had the added stresses of the workforce crisis that was created by a lack of migration during those 2 years of COVID. But to have such rigid requirements, there was a lack of any flexibility in the exemption criteria that were put forward right up until almost the death knell after we started to see nursing homes close because they were so worried about their ability to meet this requirement. Did we see any change in the narrative from the government? So whilst I absolutely acknowledge we should be aspiring to be delivering the best possible care, the reality is, you can legislate for the sun not to come up tomorrow morning, but it still will come up. And this government legislated for something to be in place by the 30th of June this year that was never able to be achieved. And in the process of doing that has caused great distress. And we have seen nursing homes close and older Australians pushed out of where they live because of the government's absolute belligerence not to actually accept the recommendations of the Royal Commission or the advice of the sector over the last 12 months.
On the tobacco tax and the crackdown on vaping, do you welcome this focus by the government in trying to stop the spread of tobacco use among young Australians?
Look, I think every Australian wants to see young Australians protected from getting access to vapes. I mean, the fact that young Australians can walk down to the corner store and get a bubblegum flavoured vape without any restriction whatsoever is something that I think every Australian thinks is unacceptable. I think the challenge that I would put to the government after the announcement that we saw yesterday is there are a whole heap of questions that probably still need to be answered. One, most particularly, is around enforcement. It's all well and good to make a headline announcement that you're going to crack down on access to these vapes. But what is the government doing about speaking to their state and territory counterparts to make sure that's enforced? Because right now, it is illegal for any store to be selling a nicotine-based vape from a corner store. You require a prescription to be able to get a nicotine-based vape. So the laws are already there, they're just not being enforced. The other question is, right now, if we're going to crack down and we're going to stop any access to importation in relation to vapes, the 2 million Australians who currently vape, what is going to be the consequences of that if they've got to go to a doctor? We know that GPs are already under extraordinary access pressure. If we're going to be expecting these people to go to a doctor to get a script, what's that going to do to the pressure in the healthcare, the primary healthcare sector? What are the complications and implications for the black market? What are the implications for people who are currently vaping? Could they be forced into smoking? I'd like to see a lot more detail, but of course we welcome measures that are going to protect Australians, young Australians, from becoming addicted to vapes, because clearly, whilst they may be a little bit safer than smoking, they still are not a safe thing for you to be doing.
Shadow Minister for Health and Ageing, Ruston, thanks for your time. Appreciate it.
My pleasure. Thanks, Kieran.